Welcome to Friday for our 12 Days of Christmas. I'm so excited to welcome Dr. Chorley.
Hello.
Everybody knows Dr. Chorley, our favorite English doctor, is what he always likes to say. So he is at our Bixby facility. For those of you that have seen him, you absolutely love him. And so he has a lot of great information to share with us today. So today we're going to be talking about Samoralin, correct?
Yes.
And the benefits of Samoralin. And you've got some new data for us and new information.
Okay. Well, Samoralin has sort of gone wild since we've been introducing it for use in my patients who have Ehlers-Danlos syndrome. There is precious little that actually treats the underlying pathology of Ehlers-Danlos syndrome. And for those of you with that, you'll know that it governs every part of your waking existence. Samoralin is a human growth hormone releasing factor. And what it does is it amplifies the amount of human growth hormone that you produce while you're asleep. Now, it's available in subcutaneous shots, but the more popular thing is the nasal spray. And you spray it, one spray up each nostril before you go to bed at night. And your body naturally produces human growth hormone while you sleep. Now, I tell my patients, you shouldn't really expect an improvement within the first month. But this week, one of my patients called in and said, I've been on it for 3 weeks and I feel really strong. And please don't stop this. And we got her on a monthly program where she takes 20 days of the month. She'll be taking nasal inhalation for 6 months at a time. She'll go off it for 6 months and then come back on it for 6 months. And she is thoroughly pleased right now with the results. It's difficult to say this will work for everybody across the board, but subjectively right now, I have had one complaint, and that was about the nose spray, because some people just don't like spraying things up the nose. And so we'll switch to a subcutaneous shot at bedtime for that particular person. But in the long run, it stands to strengthen people, give them more functional capacity, and stabilize individual joints. Now, I say to my patients, we can't treat children who haven't finished growing in the vertical direction because we don't know what it would do to the growth plates. This isn't immediately obvious, but you might end up with arms that grow longer proportionally to legs, and that's not a great cosmetic look. We can't treat pregnant women and nursing mothers, and we can also not treat people who may have cancer because, again, even though it increases the natural production of your own growth hormone, we don't know what that would do to somebody with a malignancy. So it's important that we, as medical people, monitor people on Samoralin. We're not giving you this off the internet and saying, goodbye, we'll see you in 6 months. This is part of the relationship between the physician or the nurse practitioner and the patient. Now, for my Ehlers-Danlos patients, it's a wonderful opportunity to try to improve your quality of life. There are 2 other groups of people that are going to significantly benefit from Samoralin. One of those groups of people is near and dear to me. It's the people who've lost weight on the GLP-1s. GLP-1 receptor agonists saved my life. I went down from 233 to 165 pounds. It corrected my diabetes, and I'm enjoying life to the full now. For those of you who know me, I just got back from Africa from a missions trip. It was wonderful, and I was able to be physically active, whereas 3 years ago, you wouldn't have caught me doing that. So the people who lose weight with GLP-1s tend to lose weight uniformly, both fat and lean muscle. Samoralin will help you restore the lean muscle, the strength in your body that you need to get up and do what you need to do. So for people who've been delighted by losing weight, there may come a point where Sermorelin actually increases your function, increases your ability to exercise, increases your muscle strength. And that's something that I ask my patients to consider. The third section, the third group of people are the elderly. Now, I woke up this morning and found myself to be elderly, much to my surprise. Going to be 68 next birthday. So as people age, they get weaker, they get more frail, and the final event in a person's life that gets them into where they pass on is usually a broken hip, at least in the United States. With Sermorelin, we can delay or prevent the broken hip because we can increase body mass by increasing the output of human growth hormone. Human growth hormone declines naturally every decade, and so I don't produce as much as I used to. Now, younger people don't necessarily need it for that, but sometime as we progress in life, you're going to start losing muscle strength. You're going to lose grip strength. Now, I have the ability to measure your grip strength, so if you want to come in and see me in the office, we'll measure your grip strength, and then we'll start you on Sermorelin and see how your grip strength increases over time, and you can get an objective result as your grip strength improves. Mind you, I'm also going to have you exercise to improve your grip strength as well, but it's actually a good predictor of frailty and a good predictor of longevity. So I've got great results from Sermorelin, and I'm really encouraged by the findings in Ehlers-Danlos. I'm encouraged in the findings with lean muscle gain, and I'm encouraged by the findings from longevity treatment, treating the elderly. And it's not too late at any time for somebody who's feeling weaker than they should be, and everybody's got somebody in the family. They've got really good cognitive function, but they just don't feel strong enough. Those are the people who would benefit the most from Sermorelin in that particular group. If you have somebody who's perhaps got some dementia, that may not be appropriate for them. But if you've got good cognitive abilities and you just don't feel up to doing what you need to do, Sermorelin is going to add to your quality of life, add to your longevity, and it's going to make the people around you happier because they're concerned. So it's Christmas. It would be a really wonderful present. It would be a present that would, you can't quantify the value of giving somebody extra strength, extra longevity, a better quality of life. Anyway, I'm going to ask Krista if she's got any questions for me.
I do have a question. So when you, especially people on GLP-1s, I mean, they lose so much weight so quickly, and exercising is so important. We've talked about hormone replacement therapy as well, and how a lot of women lose testosterone, and that can help out with the Sermorelin to get strong. But you talked about exercise. What exercises do you recommend your patients to do and start off with?
Well, I recommend start at what you can do. Now, again, I have people with Ehlers-Danlos whose joints are all frail and hyperextensible. I will have them just do simple cycling exercises in a seated position. You can get a small cycle exercise machine for $40 from any of the sports outlets, and you can sit and you can watch the TV and you can cycle your feet. That's better than nothing. Cycling your feet, or even doing toe lifts, if you can't do that, it improves the circulation in your legs. It reduces your risk for deep vein thrombosis. It gets you in the habit of doing something. Once you're in the habit of doing something, then 5-pound weights each arm. If you can't do 5 pound, do 1 pound. It's the reps. It's not the moving of the mass. It's the getting into the habit of exercising, getting the circulation improved to the muscles. Once you improve circulation to the muscles, oxygen going to your muscle mass, the body wants to be healthy. So inactivity is the worst thing for you. The day you don't get out of bed is the day you begin to die. So you get up, you get mobile, you get active. Now you need to be safe. And that's where I think we have some advantages in the medicines that we can give you. So did that answer your question?
I did. And I know that you said young people may not be as concerned about it, but we are seeing more and more young people with no muscle mass. And so can you talk about the importance of when is the most opportune time to start this?
When you say to yourself, I'm only 28, I should be able to do such and such. You get to a realization in your mind that, I shouldn't be as weak as I am. I shouldn't be as exhausted as I am. I should be able to work my regular job, get home, and just not go to sleep. If you're doing that, if you are exhausted at the end of the day, if you are just sitting at home, comforting yourself with a tub of ice cream, that's a dangerous sign. So, activity, you were built to do stuff. So just ask yourself the question, could I be better? Most of us will say yes. Now, most of us don't want to be dependent on medicine. I hear that a lot, and I hear you. But you could consider sermorelin, or you could consider testosterone supplementation, and there are other longevity medicines out there that we have access to that I don't want to get too detailed into, but we have the ability to improve your function in other areas that are real important, and we have the ability to customize your medical treatment according to your needs, and I think that's a wonderful thing. But we also have the ability to listen to you. Lots of people go to the doctors and they don't feel like the doctor's hearing what you're saying. And if you're going to a doctor like that, come give me a chat. We'll make some space for you.
Now, Dr. Chorley does have a waiting list, so if you are in line to see him, it does take a little bit to get in, but most of our other providers do sermorelin. And so we can take care of you. And like Dr. Chorley said, we do sermorelin. We have other peptides like NAD+ that we're rolling out. We have hormone replacement therapy. Axis is really into longevity. And going into 2026, we're really going to be focused on this. So stay tuned. We would love to see you at our practice if you're not a patient yet. But call us, inquire about sermorelin. We have great, fantastic pricing on that. It is cash pay. Insurance does not pay for it, but just like GLP-1s, when insurance doesn't pay for it, it's worth it. So get a consultation. Let's talk about your health. We can go from there.
Absolutely.
Sound good? We're on to our announcements about our golden syringes. So next Wednesday, Christmas Eve, we are going to be giving away 2 golden syringes. How do you enter to be a golden syringe winner? Which a golden syringe is a free month of meds. So we're going to be giving away 2 of them. The first way to enter to win is just purchase any time in December any weight loss medication. Every time you purchase a weight loss medication, you're automatically entered to win. And then we're going to be giving a second golden syringe away to one of our Total Body Reboot members. Total Body Reboot members get an extra free 5th week this month. It's $40 a month. You get $40 off. And right now, if you join between now and December 31st, you get half off of the program fee. So it just totally makes sense. Plus you get a free 5th week. And for every friend that you send to our practice that purchases weight loss meds, you get 2 free weeks for that. That's an awesome deal. Become a Total Body Reboot member, and we are going to draw a name for one of those members to win a golden syringe and a free month of med. And so we are going to move on to our winners for the question yesterday. The question was, do you prefer a cozy or white Christmas? Next week, I think the temperature has gone up to 80 degrees, so it's going to be definitely nice and cozy. And so I'm so excited to tell you about our local partner. We are partnering with Twisted Soul Sisters. This boutique is amazing. If you haven't been to see them, they are in Bixby, locally owned, locally operated. They have the cutest clothes. So as you are shedding those pounds and those sizes with a GLP-1, go get yourself something nice. Go into the store, go check it out. The people there are absolutely fantastic. They are so sweet. They have jewelry, sunglasses, candles, so many fun things. It's called Twisted Soul Sisters, and their motto is you don't have to be twisted to shop here. So it is so cute. They are giving away, this is a Christmas graphic transfer sweater or t-shirt of your choice. So if you are the winner today, you get a Christmas graphic transfer sweatshirt or a t-shirt of your choice. You get to pick the style, the size, and the print. There's 20 different designs to choose from. And they have so many other cute things like this. So we are so grateful to them for donating the prize today. They also have some specials going on in their store. So they have a buy one item and get the second 50% off. So go check them out. So our winner for this sweatshirt or sweater is Angela Tilliston, and she said that she loves a white Christmas. I'm with you. I wish we were getting a white Christmas this Christmas, but congratulations, Angela. We will be reaching out to you to get you your prize for Twisted Soul Sisters. We also have 2 winners for Access. The 2 winners for Access are going to be each getting 4 free mix shots. Perfect to keep your energy up going into the new year. Our first winner is Laura Reynolds, and she said a cozy Christmas. So we're so excited about her winning the 4 free mix. And our second winner is Elijah Youngman, and she said that she loves a cozy Christmas as well, especially if there's a dusting of snow. She'll take anything. So congratulations to our winners today. So you can follow our page to win on Monday. Follow our page, like us, and answer this question. Dr. Chorley is going to answer this question for us. We want to know, how much weight have you lost, or how many sizes have you gone down? So all you have to do is comment how much weight you've lost and how many sizes you've go down in order to win our Monday prizes, which are going to be awesome next week going into Christmas. So Dr. Chorley, you said you kind of lost almost 70 pounds?
I went from 233 pounds to 165 pounds.
Wow. And you've kept the weight off.
I've kept the weight off. Now, I'll fess up. I was in Africa 10 days ago, and I skipped a shot. And that, with the high calorie, high carbohydrates and traveling, I put some weight on. I'm getting my shot back. It's in the mail to me. I get my shots the same way everybody else does. And within the next 10 days, even though 10 days from now is Christmas, I will be losing at least 3 pounds in those 10 days. I know that because that's what I've experienced. And I will be back to about 165 pounds by New Year's Day. I promise you. And we'll follow that up in a video just to make sure that I did that. Okay? So you guys keep me accountable.
Absolutely. Okay? We all love hearing from Dr. Chorley. Thank you so much for joining us today. We will see you guys live on Monday at 12:30. Merry Christmas. Thank you, guys.
Bye, guys.